Our third technique in our protocol for treating torticollis and shoulder dystocia is what we call a sternum vertebral or vertebrae technique. Now, with your newborn in a seated position, you're going to sit at the patient's side with one hand on the sternum, with your fingertips contacting the sternum, and the other hand's fingertips contacting the upper thoracic spine, which means that we're going to have our fingertips on T1, T2, T3, T4, which is the upper thoracic, upper gastric region. This is the region of the lungs and the esophagus. And we're going to have our fingers contacting the similar areas of point of insertion of the first, second, third, and fourth rib on the sternum. And then we're going to listen for the cranial rhythmic impulse. We're going to follow the movement of the sternum in relation to the thoracic spine with the intention of feeling for any restriction in the natural movement of the underlying fascia. Now, what does that mean when I say feeling for any restrictions within the underlying fascia of the thoracic area? Well, the thoracic spine moves also within its own cranial rhythmic impulse upwards towards the head as it moves into flexion. Simultaneously, the sternum moves downward or towards the feet, and so what we have is this kind of effect, where they move simultaneously in opposite directions. The opposite occurs within extension. When the spine goes into extension, it tends to move downward, and the sternum tends to move up. So once again, the sternum and the thoracic spine tend to move in opposite directions within the cranial rhythm in flexion and extension. Underneath that, the thoracic myofascial structures also follow the movement of the sternum and the thoracic spine. So our goal is to increase range of motion of the anterior and posterior thoracic fascia through increasing mobilization of the sternum in relation to the upper thoracic spine. So you're going to follow the movement, and if you feel that there is a restriction of either the sternum, for instance, might be stuck in a direction of flexion, we might want to help induce some extension, and thereby also simultaneously inducing some extension within the thoracic spine. So we're trying to release the fascia in this area, increase range of motion. This is going to reduce any hypertension or compression on the esophagus. And we know that the esophagus needs to have just the right amount of tone and tension in order for it to function properly. So this is a technique that, as we've seen, would help for any upper gastrointestinal reflux problems, but also because any problems with regards to movement of the arm, upper limbs, and cervical spine are going to be very much affected by any restrictions in the upper thoracic area, because we have the brachial plexus that exits and passes through here. So any restrictions in the upper thoracic fascia will affect the brachial plexus, blood flow and innervation into those nerves, which are going to control the myotomes and dermatome function of the arm, but also free movement of the clavicle and the scapula, which we mentioned earlier, which are also crucial in terms of facilitating range of motion of the arm and of the cervical spine. Very good.